All right, everybody, good afternoon to you. This is a special edition of the A Different Echelon podcast. This is a very big honor for me to have this, like we say down south, this young lady as a guest on the Different Echelon podcast. She's somebody that I've kind of like, we joke like we somewhat know each other just through mutual acquaintances. But just so happy to have her. She is a shining star in the Charleston area and in the healthcare field. As you can see, she is beautiful. She's Black. She's proud. So let's welcome into the Different Echelon family, Dr. Zora K. Johnson. Zora, what's up?
Hi, how are you?
I'm doing well, and yourself?
Good, good. Thanks for
Good.
having me.
Oh, absolutely. It's my pleasure. It's my pleasure. So, just a little history on Zora and myself. Just through the power of social media, and I always talk about the power of social media. We were Facebook friends for probably like 2 or 3 years before we
Yeah,
actually met in person. And as I can remember, I was talking to my friend just a few minutes ago, and we were talking about you being on today. And he was like, "Well, how did y'all meet?" And I said, "We were Facebook friends for a minute, but I think we met down at a local club, um, like supporting a mutual friend
right,
of ours who's a very good friend of yours, Black
right.
Diamond Christian Smalls. And I
Hmm.
saw you from across. I was like, I think I know that lady. So went over and I said, you was like, I think I know you too. So, from that point, we just became friendly and just follow each other on like social media, following her on Facebook. She is doing great things in the medical field. Every time I see her, she has either a full shield on her face, a gown, or she's got her white jacket on, her white coat. So, before we get into the whole medical thing, we always start off with something important and something kind of serious, which, the broadcasts are all serious, but like to hit on something social. Um, you know, we just saw once again what I would call police brutality happening to another brother of ours, and we're all family. Mr. Walter Wallace Jr. from Philadelphia, PA. For those of you who may have been under a rock for the last 48 hours, he is an autistic gentleman up in Philadelphia. I believe the police were called to help him and help his mother kind of corral him. For those of you who don't know, autism is, I would say, a sickness, whereas in, they don't process information like, some of us do or most of us do. At any rate, he was seen in the street and cops drew their guns. He came toward them with the knife. In my opinion, he was not close enough to really cause imminent danger unless he was a karate expert that can throw a knife, 20 feet and get them in the heart on an important artery, the jugular.
Right.
And the cops just let off on him and shot him and killed him right in front of his mother. And onlookers, of course, everyone has a camera, and there were several photos and videos taken of him being slain in the street. And I think the most haunting part of that is to hear his mother scream out, "No, no, no!" And I think she was saying before that, "Just let me talk to him. Let me talk to him. I can get him to put the knife down." So we've seen this too much, and I have personally decided, Zora, and to the family, I am not going to watch any more of these videos.
I know.
These are snuff films. To me, it's just like watching a beheading of an American by a Taliban member. And I'm not with it. I refuse to allow this to become a commonplace for me.
Right, right.
So, real quickly, your thoughts on that incident, what would you say?
I kind of feel the same way you do. I know I always feel like there's a mix between outrage and just pure sadness.
Hmm.
I don't really understand. And so many people have said the same thing. And so I just wonder, like, does this reach the ears of the police chiefs? Or I don't know a lot about the policing system,
Hmm.
who's training them or things like that. But it seems almost like, to me, it almost seems like it's such an easy fix
Hmm.
that the fact that it keeps happening, it makes me feel like they don't want to fix it. You know what I mean?
Right,
So
right.
it's like training, and I've heard people say, I don't know how long police officers train. I don't know what exact type of training they get,
Mm-hmm.
but just like in the medical field, we have like empathy training, diversity
Yeah,
training.
right,
Like, do they do those kind of things in the police departments?
right, right.
Or what it makes me feel like is people like to compare the police department to the Ku Klux Klan, and I know
Mm,
everybody's not the same,
right,
and every white or officer in the police department is not racist, but it makes me feel like overall that actually could be the case,
mm-hmm.
because like how hard is it for the higher ups to really take steps to change this behavior coming
Right.
from the police all over the country.
Mm-hmm. Mm-hmm.
And so it's really sad to me. It's really enraging to me. My
Right.
heart goes out to each and every family. You
Mm-hmm.
know, when another one happens and another one happens, I'm like, I don't know if I want to watch the video. And then somehow I always end up watching it. But I kind of understand what you're saying. Like,
Mm-hmm.
it's traumatizing
For sure.
over and over and over again. And even if it's not your brother, your sister, your loved one, your mom, your dad, I think it still does take a toll on us mentally.
Mm-hmm.
We have to be careful what kind of energy we allow into our circles, into our
Mm-hmm.
atmosphere.
Right.
So I'm starting to kind of feel like you do. Like maybe I don't need to watch any more of this because it makes me mad, and I don't
Right.
want to be the angry black girl every time I see a Caucasian person.
Yeah, and I'll tell you this, Zora. The issue with it is, and thank you for sharing that because you have intense training, in medicine, and we'll go down through your accolades and your accomplishments in a second. But what these things do is either consciously or subconsciously condition you to feel a certain way about someone who looks different from you.
Right.
And that is the whole essence of, racism. That's the whole essence of, I'm better than that person. And I had a friend of mine who is of a police, works at the police department. He's a sergeant. And I had him on. He was like one of my first three guests on the podcast.
Hmm.
And he shared with me the training that they get. They do, I believe it's 12 weeks of training or not. See, I think it's 12 weeks of training. I want to be safe to say 12 weeks of training. But there is 3 weeks of just psychological stuff. And personally, I do believe that if a physician, and I'm going to, switch over, a physician has to do 4 years of medicine, 4 years of bachelor's, and then 4 years of medical school. And I have a GI background and considered medical school at one point. It would have been 3 years of internal medicine and then 3 years of GI. So we have 10 years of training after bachelor's. So my thing is just like they're in charge of somebody's life, these
Right.
people with these guns are in charge of
Right.
someone's life after 12 weeks.
Right.
The math
Exactly.
doesn't add up to me. And
Right.
I'm not going to say let's defund the police. I'm not anti-police, but I'm anti-behavior. And
Yeah.
this behavior is unacceptable.
Yeah.
And like I said, I do feel like, with social media, we do a very poor job of always showing. I know you want to show things to spread the word and to let people know about what's going on, but sometimes too much is just too much. So
Yeah.
personally, I just feel like, and I said before, I'm not going to watch it anymore. I can hear about it, feel free to tell me or text me just so I can be aware because, knowledge is power. But
Right.
to see it so much and become desensitized, I just can't deal with it. So, as we just cross over into, why you're here today, like I said, you are a person, Zora Johnson. How I look at it is you probably have just as many letters in your degrees as you do in your name.
Oh my gosh.
So, so with that being said, I'm gonna give you a chance to brag on yourself a little bit. Let's take it from the tippy top.
The tippy
And
top.
the tippy top. Let's find out, why did you decide to go into medicine from the jump?
So from the jump, the first thing a lot of people know about me is I'm very indecisive. So originally, my first degree in life from Howard University, the real HU, by the way. Anyway, my first degree,
I'm just
my
playing, guys.
first degree was actually in audio production and communications.
Oh,
Um,
okay.
And then I came back home because one thing about Howard is they will make you feel like a celebrity, especially in school of communications. You feel like you're above the world. You have all these internships up there, and then you graduate and you're like, whoa, I'm just a regular person. So I
Right.
came home, tried to figure out my life, moved to Chicago to go to grad school for media management. I always wanted to work for a record company, actually.
Okay.
But then in the back of my mind, polar opposite extremes, I wanted like some kind of certificate or backup in the medical field, just because I
Okay.
know how fickle the entertainment industry is. I
Right.
know or hustler grinder you have to be. And I really kind of get my connections just from being that like laid back, chill friend. And they're like, oh yeah, I know her, I know her. So I didn't know
Right.
how that door grind was gonna work for me.
Mm-hmm.
But I wanted to back up in healthcare. So I thought like when I finished grad school in Chicago, I would get like a CNA certificate or something like that. But life happens.
Right.
Um, I was in Chicago one Saturday morning. My mom, and she's like, "Hey, I'm trying to figure out how to tell you this, but I just got diagnosed with pancreatic cancer and they're giving me 9 months."
Oh man.
So I week or so and tried to figure out what I was gonna do. And I came home to visit her, and I just decided like, there's no way I can stay up here for another year if my mom was gonna die in 9 months and not be by her side.
Right.
So I got out of grad school, moved back to Charleston from Chicago, took care of my mom, and I was like, in my mind at that time, I wasn't really connected to the music scene here, but I was like, I don't really see like how I can get on a record label or anything here. So maybe I should flip flop things
Right.
and go to school and kind of do like things like that as a hobby more so.
Mm-hmm.
So that's what I did. I went to nursing school. I already had a bachelor, so I could do the accelerated program at the medical university, which was 16 months. And I think by the time I did prerequisites and all of that, my mom ended up living 2.5 years instead of 9 months. She did
Okay.
really well. And then she died in my third semester of nursing school.
Oh man, I'm
And
sorry to hear that.
yes, thank you. And by that
Yeah.
time, just taking care of her, taking care of patients in school, I was just locked into nursing. Like, I realized, of course, I wish my mom was here, but I guess things happen in life that put you where you're supposed to be.
Right. Right.
I guess nursing is where I was supposed to be. I love it.
Right.
I knew I wanted to further my career in nursing. And I wanted, after I finished nursing school, I got a couple years of experience because at that point I had no medical background.
Okay.
So I worked for a couple of years and decided I wanted to pursue my nurse practitioner license.
Okay.
Um, and so I went back, re-enrolled in the medical university into the doctorate of nursing practice program. And 4 years later, because I went
Okay.
part-time because I still had to work,
Right. Of course.
4 years later, this past August, I graduated with my doctorate in nursing practice with a focus on the family nurse practitioner track.
That is excellent.
And here I am.
Oh man, that was
Thanks.
that is excellent. First of all, like I said, I had no idea that all that happened. You know, it's funny
Yeah.
because life does happen and you have to make certain adjustments, for your family and everything like that. And
Right.
so with that being said, again, brag on yourself. What are your degrees? What are your degrees?
Say that one more time. I'm sorry.
What are your degrees? Like, can you list off your degrees? So you have
Okay,
a
so I have a Bachelor of Arts in
okay,
Communications.
okay,
I have half of Masters in Arts Management from Chicago. Then I have
okay.
a Bachelor of Science in Nursing from the Medical University of South Carolina. And
Hmm.
then I have the Doctor of Nursing Practice degree from the Medical University of South Carolina. And on the way to getting your doctorate from the bachelor's, you also get your master's. So what, like 3.5 degrees?
Wow,
Yeah.
wow. That's great. That's great. Some of us don't even have a half a degree. But listen, that's excellent, and I do believe that knowledge is power. Like we were talking a little bit off camera, knowledge is power. And that being said, so what is your concentration like, as far as a doctor, nurse practitioner? Like, where are you now, in that whole situation? And do I need to refer to you now as Doctor Zora? Like, how you going? How you going?
I mean, my technical title is doctor, and I definitely,
Yeah.
have worked hard for it, but I'm such like a chill person. Like even if
Right.
when I go into practice, if I use doctor, it's gonna be like Dr. Z or something.
Yeah. All
I
right. There
probably
you
won't
go.
walk
You got to
around
make it cool.
Zora Johnson. Yeah, like I'm
Yeah.
just so yeah, that's it. My focus is family nurse practitioner. So I can cover the gamut from birth to the end of life.
Hmm.
The focus for family nurse practitioners is typically primary care
Hmm.
and preventative health.
Hmm.
Um, I do have a passion for women's health and preventative care in the underserved community. That's big for me.
Yeah. Yeah.
So, of course, I have zillions of dollars in student loans at this point,
Hmm.
but there's a finding the balance between having a lucrative career, but I
Hmm.
believe like more so your job makes you happy by your passions.
Yeah. True.
um, so I'm really into the underserved community. I really want to do outreach and help people and things like that. So
Hmm.
I'm just right now I'm still working as a registered nurse. Like I said, I just finished in August. I'm currently
Hmm.
studying for my certification boards, which I
Yeah.
plan to take no later than January,
Okay.
and then start looking for a nurse practitioner job that interests me.
Right, right. And that's interesting because, like I said, I have a GI background, and I remember, I started my medical career in 2004. And, whenever you go to the doctor, you always just saw the nurse and then the doctor. And
Yeah.
now, do they call them nurse extensions now? Is that what it's called?
Who? Like the nursing
Yeah.
staff?
So I guess what I'm asking, like, you have an NP, nurse practitioner.
Uh-huh.
All right. And so what I'm trying to get at is that, a lot of times, and I was going to ask you this, like, what are some of the things that you anticipate? Because people are so used to seeing the doctor and everything,
Yeah.
right? Yeah, you know what I'm
Yeah.
saying? Like, it's just like that gray area. I mean, I feel like
Absolutely.
it's changing now, but there was a time period where you had to see Dr. Johnson, or you like, you know what I'm saying? As like there's this whole stigma associated with a person who went to medical school and those kinds of
Right.
things. So, what type of I don't want to say pitfalls, but what type of resistance, or what would you anticipate, feeling, from that?
It's not even anticipation. It is like what it is. You're exactly right.
Okay.
You get it kind of from both sides.
Hmm.
Um, so primarily, I feel like the nurse practitioner is looked at as a person that's going to fill those gaps to access to care.
Right.
Like doctors are overwhelmed with
Yeah.
people needing care, follow up, things like that. So we're really appreciated in filling those gaps, taking
Hmm.
care of those people who can't get in to see these other doctors. At the same
Hmm.
time, you do get some resistance. Some doctors don't like the fact that we're called doctors. I
Right.
mean, there's millions of areas of education that you can get a
Hmm.
doctorate in. It doesn't mean you're a medical doctor. I don't
Hmm.
take anything away from medical doctors. Like I didn't
Right.
go to medical school,
Right.
but my degree is a doctorate, which makes
Yes,
me
it
a
is.
doctor.
Yes, it does.
Sorry, not sorry.
Right.
you
Yeah. No
know?
doubt. No doubt.
So um but I don't think I'm any better. I don't try to take any accolades that I didn't earn. You know what I mean?
Right.
So at the end of the day, and then like you said, some patients, especially like older patients,
Right.
I don't want to see no nurse practitioner. Where's the doctor?
Right. Right.
Things like that. I get it.
Yeah.
We know what's ingrained in us. But
Right.
like you said, things are changing a little bit as we're used to filling more gaps for care.
Hmm.
And as sickness, like the prevalence of sicknesses get higher,
Hmm.
people need us. And
Hmm.
so we're gonna get
Hmm.
in where we fit in and fill those
Right.
gaps. But yeah,
Hmm.
there's some resistance, but I have tough skin. I'm okay with that.
Yeah, you do have to have tough skin, and being in that, and if I may say this, and this is meant as no slight at all, but again, I'm talking from experience. Speaking from experience, women have a hard way to go in medicine too.
Right.
I know someone who's a physician, and he told me that a lot of times, female doctors, that they go to medical school, they will be mistaken for nurses all the time, and they have a white coat on just like the male doctor. And I
Yeah.
know times are changing, but people still have that mentality, and it's very important that we go with the time. And specifically speaking about Black people, I know personally, like as far as sicknesses go, my late father was from Somerville.
Okay.
And, as a South Carolinian, you know how we get down. We like rice. We
Yes.
like grits. Matter
Yes.
of fact, I told somebody today, I was like, yo, I really want some cheese grits and corned beef hash. Like that would set me off so nicely. I mean,
Right.
I consider myself to be a New Yorker living in the South, but at the end of the day, when my father and when my grandmother, God rest her soul, Rebecca Nolan, will make that corned beef hash, the way that thing go down is crazy. And that's
Every
one thing we fight that, we fight those urges and we fight those things like diabetes, high blood pressure, so if you could speak to the audience about managing those types of things, can you give us some alternatives? If I know you may not have a background in nutrition, but just in your array of knowledge,
right.
how will we kind of deal with those things, those urges?
So we just have to realize as a people, myself included, we
Yeah.
all have things, that we can work on, taking
Hmm.
care of our health. We have to realize that education is key and
Right.
that we are our own best advocate. If you
Right.
want to be healthy, you have to take the steps to make yourself healthy.
Right.
Black people are already more predispositioned for some of
Hmm.
these diseases.
Hmm.
Diabetes, hypertension, alcoholism,
Hmm.
all runs on almost on both sides of my family. So I'm
Right.
already predispositioned. You know what I
Hmm.
mean?
Right.
So we really have to. I'm not a nutritionist, but in school we did, find out the value of nutrition.
Right.
We have got to, not saying that you can't eat your cheese, grits, and
Ooh,
corned beef hash.
thank you, Jesus.
On the other side, you need to realize what things give you fiber, what things give you
Yeah.
protein,
Right.
things that can kind of offset that grease and that
Hmm.
fried and those carbohydrates.
Hmm.
Like it's really about education, and those educational facts are actually not that hard to find.
Right.
In medicine, we're taught not to Google things.
Right.
We need factual, evidence-based information,
Hmm.
but for basic like food groups and foods that are good for diabetes versus foods that are bad for it, that is absolutely something that a regular person in our community can Google.
Hmm. Right. Right.
Now, when I go to the grocery store, like what do I need to be looking for? Or what do
Hmm.
I need to add in?
Hmm. Hmm.
I know people that say, I don't like vegetables, I don't like water. We're too old for that.
Right.
And
True.
we get
True.
okay. And we're
Right.
getting older every day. You may not like every one of them, but you definitely need to find something that you do like to offset those bad things that you eat. And we all eat bad things.
Yeah, I agree. And me personally, and I shared this on a previous podcast with a gentleman that I had. He's a trainer from out of Charlotte. And I was telling him, like, 4 years ago, I had a scare where I went to the hospital, got admitted for something, and my blood sugar was in the 300s. And I
Mm,
had to come to Jesus meeting with the doctor. And he basically gave me, the penis talk. And he
mm,
said, if you don't want to use this anymore, go ahead and keep eating your corned beef hash, and I'm a big guy. I like starch. I'm not one to crash on Savannah Highway if the hot sign is on Krispy Kreme. I'm like, that's not me. But I like
right.
potato chips and those things. But those things all turn into sugar. But anyway, the point is that I think that we need to educate ourselves as to what's going to happen if you continue this behavior. And one of the things that we try to do, or we do to kind of like, um, how can I say this? We do to like pacify ourselves. We look at someone and say, "Oh, they're eating it and they're skinny." But a lot of times, your size does not indicate what the blood work is going to show.
Not
And
at all.
right, you know what I'm saying. So we have to be honest with ourselves. Um, family history means a lot. Like you said, those things run on both sides of your family. And we have to be very, very wise with this. So, if you could kind of talk about the necessities behind exercise, walking, go ahead.
I was just gonna say exercise is very important. It gets your blood flowing, gets that blood moving through your body, oxygenating your heart, things like that, which is key for staying healthy and staying alive. Especially if we are going to indulge in the fried chicken, the cakes, the rice, the grits. You have to get those things out, and you have to turn that sugar around and get it out of your body. Sweating, to get that water out. Salt chases water. So if you get water out of your system, you're getting some salt out of your system too, which will help your hypertension. It's good for your mood. Yeah, it's just exercise. It's just good for you overall. There's nothing bad about exercise. It can only make you feel better. We just have to find, and I know we're busy. I don't have kids, but I know we have kids, we have jobs, we have relationships, things like that. It's really hard to fit it in. But honestly, guidelines show you really need about 20 to 30 minutes of exercise 3 to 5 days a week. If you don't exercise at all, just starting out at 3 days a week for 20 to 30 minutes can do so much for you. And 20 minutes, we've already been on this podcast for over 20 minutes. So that's not that long of a walk around your block. It doesn't have to be high intensity training. If you don't exercise at all and you just get up and walk to the end of your street and walk back home, that counts.
Yes, it does.
And you go from there. So,
and it's funny because people are motivated by different things. And I heard somebody say one time, he said, Darius, you know what, if you can't use yourself as motivation, use somebody else. Use your mother, use your girlfriend, your wife, you know what I'm saying? Use your brother, use your cousin, like somebody in your life. And, personally, I have lost a good amount of weight because of that. I take it very seriously. I try to get up every morning and go to the gym and all that because I don't want to live a poor lifestyle, you know what I'm saying? Or a poor quality of life, I guess I should say. And like I said, I love to eat like the next person. I mean, we see each other all the time. We go out and we, you know what I'm saying? Yeah. We have a little something to, some refreshments, if you will. And, you got some, those kinds of things. I mean, they have sugar. But at the end of the day, we have to be very, very wise with what we're doing. And, I just want to kind of go into, while you're here as well, got you here to talk to the women. So let's run down some stuff about the women, some things that they need to know about. First of all, the leading cause of death in women, what will be some of those leading causes based on your research?
So some of the leading causes of death of women are two big things. Breast cancer is one of them, and increasingly so heart disease in women. So those are two big things that we need to look out for, and two things that are actually affected by what we were just talking about, nutrition and exercise. Obviously, heart disease is more affected than, cancers or breast cancers, but obesity and history and things are actually risk factors for cancer. Heart disease. The thing about women and heart disease is that the symptoms for a woman's heart attack or vascular disease is not always the same as the typical symptoms that we hear about for men. So, for instance, the main thing when people think heart attack is pain, chest pain.
Right.
And while, yes, that is like one of the leading symptoms, a pain that's like squeezing, gripping, doesn't let go. For women, we should also be aware if we're having right arm pain, left arm pain, chest pain associated with nausea, if our jaw hurts, the back of our neck hurts.
Right.
More likely than not, if your neck hurts, is not a heart attack, but that is something you need to keep in mind and be aware of.
Right.
Like, do I have that history of heart disease?
Right.
Do I eat like a pig every time I go out? Do I never get off the couch and exercise? Oh, and now my chest feels kind of funny and my neck hurts. Like, that's something that we have to start paying attention to, because early intervention for any disease is key to survival.
Right.
So in order to get those early interventions, we have to recognize what's going on in our bodies, and we have to become familiar with our bodies so that we know when something is wrong.
Yeah, and to piggyback on what you just said, a lot of times we get so busy doing whatever, and we'll have a pain we never felt before. and we'll just ignore it. And,
Mhm.
I personally, I think it's ridiculous when someone, comes in, well, how long have you had this pain? Oh, for some time now.
Mhm.
First of all, I hate that answer anyway. But if they say something like, 3 months, it's like, well, why didn't you come 3 months ago? Oh, I just thought it would go away. Well, if it doesn't go
Right,
away in like a day or so, you need to come see somebody,
right,
because so many times we hear it, and you probably hear more so than I do, just being a nurse, and they're here today, gone tomorrow. You know what I'm
right,
saying? And like
absolutely.
literally, I was just talking to so and so, and I turned around and they were dead. Like those are things that are not. I mean, it sounds silly and funny, but they actually happen.
Oh,
And
yeah.
so I think it's very important. Go ahead.
Oh, no, I was just gonna say, what I do like about nursing is that I like to get personal with people and like
Yeah.
relatable to them. And something I was gonna mention later is like mental stability and mental illness. Mental illness does not always mean you're crazy, but like
Let's
anxiety
get
and things
into
like
it.
that.
Yes, let's get
I
into it. Mhm.
have a level of anxiety ever since my mom died.
Oh.
I It's so weird. I'm in the medical field. I'm a nurse practitioner, and going to the doctor literally sends me over.
Hmm.
Like it's strange. My doctors are always like, "Oh my gosh!" Like I have white coat hypertension, which
I
like
was gonna say
your blood
that.
pressure gets
Yeah.
higher when
Yeah.
I go to the
Yeah.
doctor. And like at home it may not be as high, but so I'm one of those people. Sometimes I have to talk to myself, and that's why I'm
Hmm.
able to preach to other people. Like
Right.
if you feel like something is wrong, you have to go to the doctor, and I have to tell myself like, you not going to the doctor is not going to change what's wrong.
Right.
All If you're having a heart attack, you're having a heart attack whether you go to the doctor or you don't. The
Hmm.
only thing going to the doctor or recognizing and acknowledging these symptoms can do is actually give you some kind of chance
Right.
to make it.
Right.
And I have to even tell myself that my doctor is well aware of that. My anxiety level is super high when it comes to health ever since
Hmm.
my mom died. So
Hmm.
that's something I deal with as well. So it is silly for me to say I've had this pain for 4 months and I'm
Right.
just sitting here.
Right.
But like I can kind of understand why people do that, but it's something we definitely need to work ourselves out of because we
Right.
need to be, yeah.
Hmm. Yeah, and it's funny because I had a patient once that told me that he didn't know whether he was diabetic. I said, "Well, have you ever been diagnosed with diabetes?" And he said, "Yes." And I said, "Well, when is the last time you took your sugar?" And he literally said to me, "I got so tired of pricking my finger, and so I just kind of give myself insulin as I think I need it."
Oh,
And I was like, "Are you kidding? Like, are you serious?" And he was like, "I'm serious." And I said, "Number one, stop doing that because
mhm,
you can send yourself into basically a diabetic coma,
right.
and you can send yourself over the top." And
Mhm.
what it really is, and I don't like to use the word ignorant, but it's ignorance. And I say
Yeah,
that because we have got to be realistic about life. There's information everywhere. There's information everywhere. And we talked about it off screen. If we can pull up something on Facebook, a funny video, or somebody, like a music video or something, we can pull up, what are the risk factors for diabetes or risk factors for heart disease and different things like that.
right.
So the information is there, but I want you to go back a little bit, and I want you to speak to the female audience about the mammograms and
Yeah.
different things like about breast cancer, whatnot. Shed some light on that, please.
Yeah. So perfect topic. Here we are at the end of the breast cancer awareness month.
Hmm.
I think we all can, whether it's family or friends or just associates, we all know someone that's been affected by
Hmm.
breast cancer.
Right.
And the best thing we can do for this, again, like with any other disease, is to recognize symptoms and seek care. Even
Hmm.
if it turns out to be nothing, you'd rather be safe than sorry.
Right. Right.
So, those women that are over 40 years old, I don't care how scary it is, you
Hmm.
have got to go to these doctors' offices annually,
Hmm.
every year, making sure that we get our breast examined by
Hmm.
mammogram.
Hmm. Hmm.
In the time, in between time, we're supposed to be doing monthly self-exams.
Okay.
Like I mentioned earlier about nutrition, you can
Mhm.
Google how to do a self-exam. There's examples online about how to do it in the
Right.
shower
Right.
and how to do it while laying in the bed. That's
Right.
something we need to get in the habit. As much as we schedule our hair appointments and our nail appointments, we need to schedule our self-breast exam appointments and our mammograms.
Right.
I know insurance does not typically cover a mammogram if you're under 40,
Right.
unless you have symptoms.
Okay.
So especially for our women under 40, because at one point it was just thought like breast cancer doesn't happen to people under 40, and it's
Right.
becoming more and more common in people younger than 40, actually.
Right. Right. Like, why do you
So
think that is? Why do you think that is?
if you ask me honestly, I do think it has a lot to do with the things that we put in our body,
True.
the exposures to carcinogens. You know,
Mm-hmm.
I'm not a cook. I use a lot of microwaves. Microwave. Hey, don't judge.
Don't
Don't judge.
Go
I get that honestly, okay? I use a lot of microwaves. We eat a lot of food out. We don't know where that food is processed. We don't know where it comes from. We don't know what additives are put in that food to preserve it.
Right.
Like even I was thinking, like, I look at these weight loss commercials like Nutrisystem.
Mm-hmm.
Those meals you can keep in the closet. You can
Right.
keep spaghetti, like fixed spaghetti and meatballs in your closet.
Mm-hmm.
Something is wrong with that to me. I don't know. It might just be me. But like, we don't know what's in that can that has carcinogens or that can create free radicals in our body that causes cancer. So that's just kind of my idea as to why. Obesity, like I said, is a risk factor, and we are getting bigger and bigger in America. You know, I was never skinny as a child. I was always a thicker child. But I look at these kids today, and they are huge.
Yeah, they're grown by 12.
Yeah. And I was like, God, I was always considered plus size, but I was never that size as a child. So what kind of health conditions are these children going to have later in life? But, you know, back to the breast cancer, we just have to be aware. I myself have had a mammogram and an ultrasound, and I'm not 40 because I was trying to tell myself, if you think something is wrong, just get it checked out. It was fine, thankfully, you know, because even if you feel a lump or a bump, more than likely the bumps and lumps are benign, but you cannot take that risk. You have to get it checked out. So some things to look for when examining yourself for breast cancer, you know, a bump or a lump that feels fixed and it doesn't move, reddening of your breast, warmth of your breast, drainage from the nipple. If you can imagine how an orange peel looks, if you have any of that kind of like pattern on your breast, those are things that you definitely need to get checked out. And then if you are over 40 or for whatever reason your insurance covers it and you can get a mammogram, like, we seriously need to do that.
Now, I may have missed it, but would you say, from your knowledge, would you say that an insurance company will cover a mammogram if there is a family history or no?
So not so much just like if your one relative had it or something like that. If you have a significant family history, your doctor may be able to finagle a way to kind of get it covered.
Right.
There are certain genes which I believe are actually more common in the Caucasian community.
But I have those kind of listeners too, so speak on it.
Right. So if you do have a family history of breast cancer and you get tested for these certain type of genes that make you higher risk for breast cancer, your insurance would cover that.
Okay.
So, or if you have some kind of symptom, then it's covered by insurance. Mine was covered by my insurance, and like I said, I'm not 40, but my doctor said, okay, this is something we really could potentially look into, so it was covered.
Right. And that's powerful. Now, let me ask you something. Don't laugh, but can men get breast cancer?
Absolutely. It's a way lower risk, but men can absolutely get breast cancer. I don't know the exact incidence rate of that. The answer is yes. So,
Okay.
I mean, it may not be as necessary for men to check their breasts every month, but we just need to be aware of our bodies. I don't care if you're
Period.
man, woman,
Period.
black, white, unicorn,
Mhm.
whatever. You need to know your body
Right. Mhm.
and know your changes,
Right.
So,
Right. Yeah. No, I think that's very, very interesting. And what I like to do, like I said, I don't have the all A B C D E F G degrees that you have, but
cut it
I
out.
do, but I do have knowledge, and I do my own studies. But all jokes aside, like how it is. Like if you're in a family and you're a medical professional, a lot of time your family members will ask you a question and things like that. So I do educate myself, and thankfully I have friends like you that I can maybe like text or call or whatever, and be like, hey, what do you
Yeah,
think about this? And you can give me some advice. But all in all, like we need to get out of the habit of being ashamed. And
right.
even if you have to go with the whole line of, I have a friend that had, like go with that if you have to, just to get the information, because it's so necessary that we find a way to preserve our lives and help us live. And with that being said, again, we're in a season of COVID-19. This whole 2020 has been a what storm. And kind of give us your experiences caring for patients with COVID at the Medical University of South Carolina. Can you give us some what's been going on with that?
So Medical University has a lot of COVID cases. I will say, on me working on the women's services side, I didn't think we were going to take care of them at all, but then the pregnant people have COVID as well. So we
Mm-hmm.
have gotten increasingly more patients that have COVID.
Mm-hmm.
If they get to a certain level, we transfer them to an ICU or something like that.
Mm-hmm.
But it's affecting our communities. I will say that for us, at one point, it was almost like 9 out of 10 Hispanic mothers were positive for COVID. And it's just, things like in the Hispanic community, they live together a lot. So there
Right.
would be, multiple people in one home. So it's
Mm-hmm.
easier to, yeah. So we've seen a lot in the Hispanic population. We've seen a lot of people who are asymptomatic, don't even have a clue they have it. And then here they are to have a baby.
Mm-hmm.
And they find out that they have COVID, and of course it's so strange how it affects people so differently. And I
Mm-hmm.
know the world doesn't, every day there's new information about COVID, and that's how we feel at the hospital. Like
Right.
today, this person came around this person, the next day the research, and I mean, that's to be expected. I know it's irritating to some people, but guidelines and things in medicine are created after lots of research,
Right.
after
Right.
collecting data and information. So this thing is new for us. We're not going to know everything in the medical field. Day
Mm-hmm.
by day things change, and we just
Mm-hmm.
have to do our best to protect ourselves, and again, be cognizant of what's going on in our bodies.
Right. What do you say to those people that say that COVID-19 is a hoax?
I say in the beginning I was a little more tolerant of that. At this point, if you're still saying COVID-19 is a hoax, I mean,
Yeah, you gotta be kidding me, right?
you can't be serious.
Yeah,
Like, seriously,
I just threw that in there just to get your expression.
I
But
can't.
we're gonna wrap up in a second here. Again, thank you for your time.
Yeah.
You have a wealth of knowledge. I do want to ask you though, with that wealth of knowledge, like how much further do you want to go? Like, what's the next step for you?
So the next step for me is I'm actually thinking about doing a little travel nursing as a registered nurse while I look for my nurse practitioner job.
Yeah.
Like I said in the beginning, I was a little indecisive, which bodes well for the nursing career because you can do so many things.
Mm-hmm.
I'm not exactly sure where I want to land as a nurse practitioner. Like I said, I do know I want to work with the underserved community. I think they are a community population that needs us so much. And I
Mm-hmm.
feel like my biggest problem in being a nurse practitioner is that I'm going to be too personal with my patients, because like I really care about that patient population. I really want them to do well. I really want them to get the care that they need.
Mm-hmm.
So my next step is kind of looking for how I can really influence that population
Mm-hmm.
in my career as a nurse practitioner,
Mm-hmm.
whether that be opening a specialty clinic, opening a
Mm-hmm.
preventive care clinic.
Mm-hmm.
I'm not 100% sure, but
Mm-hmm.
I know we got
No,
to help people.
yeah, no, that's excellent. That's excellent because they need all the help they can get. We need the help that we can get. So let me ask you this question. With that being said, and in the Black community, we meet at a few places, and this is pre-COVID. But we always meet at the salons.
Yeah,
And I ain't talking about the club now. I'm talking about the salon. and because I'm getting to a question or a point, the salons, the barbershops, and the
yeah,
churches, the
yeah.
church houses. So that being said, are you available to do some talks at some churches or places
Absolutely.
like that?
That
Yeah.
was one of my favorite things
Mm,
about nursing school and nurse practitioner school. We
right.
could do a lot of clinical hours in that because you needed more like in actual clinic doctors' offices
Right.
hours. But we did some church health screenings,
Right.
things like that. I love stuff like that. I love answering questions because
Mm,
for some of us, it just seems so like the answers are so obvious, so easy. But you have to know that everybody didn't come from the same background that you
right.
came from. There's nothing wrong with that. You know what I
Mm-hmm.
mean?
Mm-hmm.
That's what I'm here for, to teach, to answer
Mm-hmm.
questions, help people reach their goals. There are people that don't even know what an A1C is, and that's okay.
Mm-hmm.
But that's why I'm here, you know?
Right.
So yeah, I'm totally open to that.
All right, absolutely. Well, listen, I have to say that this has been very enlightening to me. Obviously, I'm not a woman, but knowledge is power, like I always say, and you've done a great job, kind of explaining things, and I can tell just by how you smile and how you're just like you're very passionate about this, and this is what we need in the Black community, but also in the world. We need healthcare providers to literally care about their patients and just about the layman period. Yeah, for sure. So thank you for your time in doing this.
Yep.
So if anybody wanted to get in contact with you, maybe they may have a question, and I'll give my email address at the end of it. But could they maybe email you with the question? And
Yeah, sure.
okay.
Okay, so my email address would be Z as in zebra
Mm-hmm.
underscore K as in kite Johnson, JOHNSON
Mm-hmm.
at yahoo.com.
Okay, great.
Feel free to email me.
Yeah, yeah. She'll return your email, your email or whatever. But I did want to say that because at the end of the day, some people may get on and they may see this or hear this and may be afraid to go into like the comments, because I have a comment stroll
Okay.
here, and they may be afraid to put their name or whatever the case may be. May have a private question. I'm going to encourage everyone to not just watch this podcast and this YouTube and Facebook Live, but please share this. I'm going to do my part to boost it and get it out there to as many people as possible. I know Zora's going to share it with her people on her page. But please put this out. And if you have any questions, contact your healthcare provider. If you don't have one, you can get one. And if you just have a question, you're too ashamed to go. And I'm going to tell you something else that's a real thing. Some people don't want to go to the doctor because they can't afford the copay.
Absolutely.
That's real talk. So if you have that, and definitely Zora's more qualified than myself. But if you have any questions, I can ask people for you if I don't have the answer, and we go with that and we go from there. But again, my email is DariusNolan28 at Gmail. Please email me with any questions, any comments, any concerns. And we're just here to, number one, to educate, to enrich, and to empower. That
Yes.
just came
Yes.
to me today. You like it, Z? You like that one?
I love it.
All right. That's
I
what's
love
up. That's
it.
that, that's gonna be the motto.
Yeah.
But once again, this is Dr. Zora K. Johnson, the esteemed one. She has blessed us. Hopefully, we can have you back again later
Sure.
on to talk to the women and just to lay people and people all around as this podcast continues to expand and we continue to affect the community and the world in a positive way. So once
This is
again, this
great.
is Darius Nolan, a Different Echelon podcast with Dr. Zora K. Johnson. Thank you, Zora.
You're welcome.
Don't hang up. I'm going to end the podcast now. And you guys, please tune in next week. Next week is going to be election week.
Yes.
I cannot wait
Oh,
for Wednesday because it's after Tuesday.
yes, yes.
You know? So I'm going to leave it like that. And we'll
Yeah.
have more great guests. Next month is going to be the month of Black-owned businesses in Charleston. So we're going
Nice.
to kick it off with a good friend of mine, Mr. Demario Kitt, who has a food truck,
Oh,
barbecue food truck. Everything smoked is what he calls it. So we'll have him on next week.
nice.
Along with a special guest, we're going to do that on Monday, in regards to politics and all that good stuff. So you guys stay tuned and continue to stay with me. Continue to support this podcast and this effort. Once again, we're going to educate, enrich, and empower. Thank you guys for your time. God bless. Have a great evening. Be safe.